Hello, everyone, and welcome to today's Safety and Health Magazine webcast, Stepping into the Unknown, What We Learned from 2020 and What It Might Mean for Health and Safety in 2021, sponsored by Cority. This is Barry Botino. I'm an associate editor at Safety and Health Magazine, and I'll be your moderator for today's presentation. First, we'd like to thank all of you for joining us, and on behalf of the National Safety Council, whose employees are working away from the office currently, we hope that you're all remaining safe and healthy during this time. We'll start the presentation in a couple minutes, but first there are some housekeeping items to share with you today. As a disclaimer, the views of today's speaker and organization are their own and do not necessarily reflect those of the National Safety Council or Safety and Health Magazine. Any mention of a commercial enterprise, product, or publication does not mean the Council or the magazine endorses those items. After today's presentation, we'll conduct a question and answer session with our speaker. To ask a question, just click on the Q&A button, which is located at the bottom of your screen, type in your question, and press the send button. Please feel free to ask your question at any time at all during the presentation. You don't have to wait for the Q&A to begin. We'll try to answer as many questions as possible today, but we might not get to everyone. The good news is that any unanswered questions will be forwarded along to today's speaker. After this presentation, you'll be asked to complete a brief evaluation survey, and I'll tell you more about that a little later. This webcast will be archived, so you can access it after today's live events. To view this webcast and all of our past webcasts, please visit us online at safetyandhealthmagazine.com/events, or you also receive a link in our post-event email. With that, let's introduce our speaker today. With us is Sean Baldry, the Product Marketing Manager at Cority. In his role at Cority, Sean supports the company's health and safety solutions. He has worked for nearly 20 years in occupational health and safety with leading global corporations that serve the construction, mining, automotive, and manufacturing sectors. In addition, Sean is also a Canadian registered safety professional. Again, we thank you all for tuning in to this presentation today. And Sean, whenever you're ready, go ahead and take it away.
Well, thanks a lot, Barry, and good afternoon, everyone. Certainly glad you could make it. So I guess to start off, I'll tell a little bit of a story. A few weeks ago, a colleague of mine asked me if an interesting question. She said, if you could select a single image that would best encapsulate 2020 this past year, what would that image be? And we were doing it in a rather joking fashion. So, I took up the challenge and I scoured the internet for a number of hours, and I came up with an image that I think best encapsulates 2020, and I'd just like to share it with you right now. So hopefully you find that a little bit amusing, but the reason I bring it up is let's be honest, the past year has been pretty awful, and I always say once in 100 years kind of awful, but I think to simply write off the year entirely isn't a really effective strategy either, since despite the challenges that we faced, the past year has offered us a number of key lessons that we can learn from, and I think it will, and it has already signaled a number of challenges and new trends that are emerging that health and safety professionals and business leaders need to be aware of, so we can prepare for these trends to be able to manage risk more effectively and build better safety cultures moving forward. And that's essentially what I'd like to talk about today. So in that respect, I thought we could break down this conversation into 3 parts. In part 1, I'd like to take a quick glance back at 2020, really to discuss what were the notable events that happened in health and safety, and if possible, try to tease out some of the key learnings from those events. We'll transition into the second part, where we'll look a little bit further down the road, and what I'll do is I'll offer some of my thoughts as to what we can expect in 2021, and perhaps some of the ways organizations should be preparing for these new trends and opportunities as they emerge. And then finally, in part 3, I thought we could briefly explore how technology might help us address some of these new challenges and trends and really set our organizations on a more solid footing for success in the years ahead. So really, that's the roadmap for today, and obviously, without further ado, let's dive in. So, I think it's fair to say that with all the turmoil that's really characterized the past year, it's easy for us to forget some of the major events that occurred. And when I was putting together this presentation, I was trying to rack my memory a little bit on all the things that have happened and potentially what their effect had on occupational health and safety generally. So I created a short list. It's certainly not exhaustive in any stretch of the imagination, but I thought would really kind of solidify for us all that went on this year and potentially what that means going forward. So if we start on the left-hand side of the screen, in early January of this year, you might remember that Australia was fighting a number of pretty extensive brush fires, reaching their peak mid-month, and eventually destroying about 50 million acres of land and contributing to between 500 and 1,000 deaths. A little bit later in the month, we saw the United Kingdom officially declare its departure from the EU, and that transition period is scheduled to end at the end of this month. And then, as we all know, on March 11th, the key event of the year occurred. The WHO officially declares COVID-19 a global pandemic, and life as we all know it changes overnight. A few days after that, on March 16th, the first cities and states around the US in particular began to issue their lockdown orders. And again, the entire world was going through some of the challenges that are associated with that. In early May, we saw the CDC announce its first return to work guidelines for businesses, and we saw different iterations of this throughout the year. Little time passed, you might recall that there was a pretty significant ammonium-based fertilizer explosion in the port of Beirut in Lebanon that killed 200 people, but certainly raised and elevated the topic of process safety management once again. August 16th, again, we saw intense thunderstorms spark some massive wildfires in California. And then again, a little bit of time passed, as we all know. Quintessential event of the year, the US presidential election occurred. And then as of November 20th, Pfizer announced it was seeking FDA approval for its COVID-19 vaccine with Moderna shortly thereafter. And this kind of arrives at where we are today. So, with so many events and developments occurring throughout the year, it's certainly useful, I think, to take a look back at just some of these events to hopefully understand what they mean, what we learn from them, and maybe how those learnings may influence the way that we manage safety going forward. So I think, it's fair to say that without question, the defining event of 2020 was COVID-19. But let's again take a step back and really try to figure out what we've learned. So I think, firstly, we've learned to appreciate the severity and scale of the virus, both from a human and an economic perspective. I was checking John Hopkins' website this afternoon. I think the current tally right now is about 73 million cases of COVID-19 worldwide, with the US accounting for about 1 in 5 confirmed infections, and the death toll ticking up above 300,000 deaths this year. And certainly from an economic perspective, we saw the pandemic ravage, the global economy. In the US specifically, GDP fell about 10% in the second quarter of the year, relative to the same period last year. And though unemployment has begun to improve, I think it was around 6.7% based on the last Department of Labor report, those stats, I don't think necessarily tell a full story of the economic impact. I was reading a survey recently that revealed that 160,000 small businesses were shuttered in the pandemic, and about 60 to 70% of those businesses aren't planning to reopen. So it's having a massive impact on the economy, as we all know. I think, secondly, the virus has reinforced pretty clearly the importance of emergency planning and business continuity, and certainly that's been one of the key driving topics of the year. And COVID-19 has really shattered this illusion that existed in many organizations, that they believe that they were adequately prepared for emergencies, and really exposed flaws in business continuity planning, including how adaptable we believed our workplaces actually were to enable operations to continue when a huge portion of the workforce is suddenly unavailable, like in a pandemic disease type of circumstance. So, this has created that renewed focus on organizational resilience and risk management, and that's likely going to remain with us for some time. And finally, and I've said this before, and some people might feel it's a little odd, but I'd argue that the crisis has also had some positive effects, most notably in that it's triggered what I will call a safety renaissance of sorts. And the reason I say that is I can't think of a time where managing safety and business viability have been so clearly connected. You know, I've often said that it's literally the ability to keep your people safe that will ultimately determine whether a business survives or not in this period of time. So I, I think the key learning is that this current environment has really created a once in a lifetime opportunity for health and safety professionals to leverage this renewed focus on safety to secure the investments that are needed for organizations to be able to achieve their safety goals in the future. So the question is really, how do we secure that buy-in now for those investments when businesses are, you know, a lot of businesses are really focused on short-term survival. So that's a point that we'll return to later in the presentation, but certainly a key point that we learned throughout the year. I think the second key story for 2020 from a health and safety perspective, for me, would be the continuation of the Trump administration's deregulatory agenda. And you know, this is a pretty broad topic, so I thought it would be valuable to take maybe a few minutes just to drill down on four of what I would consider to be the most noteworthy developments. So certainly topping the list, inspections. It was reported recently that the number of OSHA inspectors dropped from about 875 last year to about 761 in 2020, which incidentally is the lowest level in OSHA's history. And similarly, there's been some information reported that the total number of OSHA inspections in the last 3 years have been lower than a similar period with the prior administration, even while the workforce grew by about 16% in that period. And for some perspective on this, OSHA employed roughly 1,500 inspectors in 1980, who covered 3.5 million fewer workplaces. So if you can kind of think about it, without a doubt, you know, this decrease in OSHA's inspection capacity is a concern of sorts, especially considering that even if hiring resumes, you know, in the new year, it's estimated to take about 18 months to get a new inspector in the field. So it really remains a question whether this lack of enforcement, these lack of enforcement resources will contribute to higher injury and illness rates in the near term, especially in those sectors where we see higher incident and fatality rates. So we'll have to wait to see what that looks like. I think the second key development on a regulatory perspective concerns injury reporting and record keeping. So certainly, you know, the other Obama era rule that was reversed quickly into Trump's first term concerned the electronic reporting rule, as we all know. And when Trump's OSHA reversed the rule, it stated that it would only collect the 300A logs and then post this information for public review. But when businesses began to argue that, you know, some of this information, they claim that the information contained confidential employee data, you know, OSHA refused to release the data, and that led to a number of lawsuits. Most notably, there was one that was issued by an advocacy group called Public Citizen. So one of the things that we learned this past July, a court sided with that advocacy group, stating that OSHA had breached the rule and ordered it to release the data. Now, that being said, I've yet to see where OSHA has published that data, and if you do know, please let me know. But I think it's probably, if it hasn't been published, we're not really holding out hope that we'll get it before January 20th, but it's going to be interesting to see how these injury reporting rules manifest themselves in the new year. I think the third interesting point on a regulatory perspective concerned Executive Order 13924. So if you're unaware of what this executive order is, back in May, President Trump issued an executive order that required all federal agencies to identify regulatory standards that would or potentially would inhibit economic recovery after COVID-19, and to consider issuing rules that would either temporarily or permanently rescind, modify, or waive those rules and regulations. And though nothing I've seen is really indicated that you know, that's resulted in a lot of health and safety protection, a rollback of health and safety protections. Certainly it's raised the alarm of a lot of workplace safety experts that are a little bit concerned about the broad scope of the executive order, you know, and certainly worried that it will provide a context for a rollback of some of these protections under the guise of economic recovery, you know, particularly in the current lame duck session. So, you know, again, I haven't seen any particular midnight rulemaking in this perspective, but you know, we'll have to wait over the next 36 days or so to see if anything comes in under the wire. And then finally, I think one of the things that's caught a lot of attention recently is Department of Labor's decision to stop its name and shame policy. So in September of this year, DOL issued a memo which essentially rescinded or restricted the ability of OSHA, MSHA, and any of the enforcement agencies to issue press releases that announced citations levied against employers for workplace safety violations. And if you recall, this name and shame policy was used heavily by past administrations as a general deterrent, really to encourage businesses to voluntarily improve their compliance by learning of the penalties of other employers in either their same industry sector or relative geography, I guess you could say. And in announcing the change, DOL's rationale was that the press releases unfairly characterized employers because, but before the citations were fully adjudicated in court, understanding that those companies could face reputational damage, despite the fact that the citations may be eventually rescinded. So, there's a number of different perspectives on this development. It shouldn't come as a surprise, though, that a lot of workplace safety advocates are voicing concern about this, principally because they're arguing that the name and shame policy is pretty effective as a general deterrent. There was a study from Duke recently that said that a single press release had the equivalent effect of about 200 additional regulatory inspections. So again, we're going to have to wait and see what happens with this policy going forward, whether it'll be continuation with the next administration, or whether we'll see the name and shame policy kind of flip back at a later time. And finally, I think the last key health and safety story that I'll focus on for 2020 concerned the election, but not particularly the presidential race, but as it reflects a couple of balloted initiatives in a couple of or a handful of states. So if you didn't hear, on November 3rd, 5 states voted to either legalize or decriminalize marijuana, including Arizona, Montana, South Dakota, New Jersey, and Mississippi, bringing the total number of states that have either legalized or decriminalized marijuana to about 35 by my count. And this invariably raises questions about, what effect these laws are going to have on workplace safety. And this result, incidentally, comes on the heels of a National Institute of Drug Abuse study that found that impaired workers were involved in 55% more workplace accidents than their unimpaired peers. And interestingly, Quest Labs, which is the largest testing company in the US, you might have heard their name with their involvement in the COVID testing, they recently stated that the rate of workforce drug positivities reached a 16-year high as of last year. So, certainly we're seeing increased rates of drug positivity in the workplace, and we're seeing more decriminalization and legalization of marijuana. There's some concern that's being raised there. But incidentally, what does this mean for employers? I think it means 2 things. Firstly, businesses would be best advised to review and clearly communicate their drug and alcohol policies to their employees, including the rules surrounding workforce impairment. Employees need to know that, like alcohol, just because something is legal doesn't mean it gives them an excuse to be impaired at work. And it's important to note that drug testing is still permitted, but employers would be best advised to make sure that the rules surrounding when testing is appropriate is clearly defined and communicated. And then, certainly businesses would be best advised to consider expanding the availability of health services for those with substance abuse or mental health issues if they have the capability of doing so. I think one of probably the lasting effects that we've seen with COVID-19 is the growing concerns around mental health. And incidentally, CDC estimated a few years ago that about 8 million adults in the US have a substance abuse disorder that's tied to a secondary mental health issue. So they kind of go hand in hand. So certainly if your business is capable, expanding the availability of those services is really going to have a positive effect. So now that we've reviewed some of those noteworthy issues, I think it's probably appropriate now that let's cast our gaze a little bit further down the road and talk about what we can expect for health and safety in 2021 and really how organizations can prepare for this. But before we do so, I'm going to flip the floor back over to Barry so we can run a quick poll just to get your impressions of what you're thinking about going into 2021.
Sounds good, Sean. Thank you. And if we can pop up our poll here, we're going to give everyone about 15 seconds or so to answer the poll question. And you should be seeing that on your screen now. The question is, what are you most concerned about with respect to health and safety as we head into 2021? And there are 5 potential answers there. We'll give everyone about 15 seconds here before we flip over to the results. Okay, and Sean, it looks like we do have a couple, obviously the topic on everyone's mind is ongoing COVID-19 management, and then secondary worker at-risk behaviors on the job. Can you share your thoughts about the results that we're seeing here?
Yeah, those results are entirely expected. I think, there's a lot of positive news in the media recently around Pfizer's vaccine, and it's certainly encouraging, but I think everybody realizes that with the logistical, the heavy lift on logistics that is going to come out of that vaccine effort, there's going to be a lot of things that businesses are going to have to manage up to the point where we have enough of the population vaccinated that we can start to remove some of those protections. So ongoing COVID-19 management is completely logical, and expected. I think, worker at-risk behavior, I would see this tying into it a little bit. How do we make sure that people are practicing those behaviors on the job that are conducive to safe work, whether that's COVID related or otherwise. So not entirely unsurprising, I guess you could say. Okay, and with that, let's go forward. So I think everybody is waiting eagerly to see what course the incoming Biden administration is going to chart with workplace health and safety over the next 4 years. So I thought it would be probably good to look and offer a few ideas of what that might look like. And certainly these were some that came off the top of my head, that there certainly could be others. But, I think firstly, when we look at agency leadership, I think we'll soon see President-elect Biden announce his picks for the assistant secretaries of OSHA and MSHA, which, to be honest, is going to be a notable change, considering that OSHA has been, quote, leaderless for at least the last, few years, and certainly since, Trump's last nominee withdrew himself from nomination at the midpoint of last year. And what's interesting is Bloomberg has reported recently that the AFL-CIO leadership have proposed a couple of candidates for Biden for consideration. Those include Jim Frederick, who is currently serving as the Assistant Director of Health and Safety for the United Steelworkers, and the other name that was thrown out was Chris Kane, who is currently the Health and Safety Director for the North America Building Trades Union. Now, we'll have to see whether Biden decides to select either of these individuals or somebody else, but I think it's a fair bet to suggest that whomever that candidate is or are will have some sort of relationship with organized labor, considering the support that unions had provided to the president-elect during the campaign. For MSHA, again, I'm not hearing of any candidates in particular to date, but again, I think it's probably a good bet that we can anticipate that whoever the assistant secretary is going to be is not going to be somebody coming from the management levels of a mining company like the current incumbent. And I think that's going to really signify potentially some of the other moves and developments that are going to occur from a regulatory perspective. And with that, I think this kind of ties well into the second point. As mentioned earlier, OSHA and MSHA's enforcement approach really dropped under the current administration, and I'm guessing that we can almost certainly expect the agencies to revert back to a more aggressive approach to enforcement, as we saw in Obama's terms. Incidentally, on the campaign website during the race, the Biden campaign wrote that it would substantially expand OSHA's enforcement efforts, increasing the number of inspectors and directing agencies to develop comprehensive strategies to address dangerous hazards. So, I think that translates into additional hiring of inspectors and just a general increase in overall inspection activity, both generally, but obviously specifically with respect to COVID-19 enforcement that we can expect in the first 2 quarters of next year, certainly. Thirdly, there's a lot of talk about new regulations and rulemaking that could come in last year. I think probably most prominent of which would be protections or regulations that would compel OSHA and MSHA to issue a COVID-19 emergency temporary standard, which I know that there's been a number of bills passed or introduced in the Senate recently that have stalled. But I think, President-elect Biden has been very clear that he supports an ETS. So I think we can expect OSHA and MSHA to release a standard very quickly into the first term. And that standard will likely require employers to do things like create site-specific control plans that are going to include hazard assessment, training, PPE requirements, and mandatory infection reporting. So I would expect we're going to see a lot more rigidity around what employers are going to have to do to demonstrate that they're taking all reasonable steps to protect their people from COVID. Beyond COVID-19, I would expect some movement in areas like the electronic reporting rule, as we had mentioned previously. I see it probably a good chance that we're going to see a revert back to the original rule as it was issued in 2016. Beyond the ETS, there's certainly been growing calls for OSHA to issue a permanent infectious disease standard, which I believe was in draft in Obama's last term. So we'll have to see where that goes. And then obviously there's been some talk about standards concerning workplace violence and heat stress that have been circulating, and we'll have to see where that goes. Beyond that, there's a number of different things potentially on the docket. One of them being there's been an omnibus bill called the Protecting America's Workers Act that was first introduced 10 years ago. It's been introduced in every cycle, and that bill proposes a number of pretty sweeping reforms across health and safety law, particularly around criminal penalties, whistleblower protections, rule changes around site controlling employers, things like that. But realistically, there's little chance of that bill passing unless the Democrats assume control of the Senate following the runoff elections in Georgia next month. So we'll have to see where that goes. And then finally, advisory committees. Many might not recall, but in September of 2017, President Trump issued an executive order which effectively disbanded the advisory committees that would advise OSHA and MSHA on some of the important work and sector-specific hazards that are going on. They haven't been operating over the last couple of years. I would anticipate that we're going to see those committees come back into some form of operation early in the new year. The second thing that I would argue that we should probably look out for next year concerns this integration between sustainability and safety. So, I think it's fair to say that beyond COVID-19, climate was the other key story of 2020. We had talked about this a little bit earlier, that the year was marked by a couple of pretty severe climate events. Those included Australian bushfires, the California wildfires, and I think Noah had mentioned that this year was the most active Atlantic hurricane season on record. So, and I think we can anticipate a significantly different approach with the incoming administration with respect to climate that we've seen from the current White House. President-elect Biden has made mention that and campaigned very heavily on the need for action around climate change, and he's already announced his intention to rejoin the Paris Climate Agreement when he takes office. So the reason I bring that up is because we continue to see safety and sustainability management become more intertwined in organizations as the years move on. Sustainability has become one of those critical levers for many global businesses to consider when they're looking at securing sustainable investments or just trying to attract talent, considering the emphasis that younger workers are placing on sustainability and environmental and social equity. And ESG or environmental, social, and governance scores are used as the principal measure to measure sustainability, and they're placing increased emphasis now on corporations' social responsibility, including the impact of operations on health and welfare of their employees. So, as economic recovery continues and organizations will continue to, seek competitive advantage to either attract talent or investment, I think we're going to see a lot more organizations place more emphasis on their ESG scores. And in doing so, I think that we're going to see a lot more emphasis on health and safety within those scores. I discovered recently there was a Bank of America study that found that investments that had better ESG scores had outperformed lower scoring stocks by about 5 to 10% in both European and US markets in the past year. And there was a recent survey by Marsh and McLennan that found that companies with higher ESG scores were 25% better at attracting young talent. So certainly, a lot of organizations are seeing the potential opportunities around sustainability and safety, and I think we're going to see a lot more interest and activity grow in the next couple of years around how we include safety into those calculations. And then, certainly we all know that COVID-19 has triggered a considerable socioeconomic change, particularly with, in respect to how and where we work. Let's be honest, remote work is likely here to stay, which is going to fundamentally alter not only how we interact with our peers, but also the type of risks that we face at the workplace, and most importantly, how we manage them. There was a recent study by Chubb Insurance that found that 41% of remote employees indicated that they were now experiencing more pain and discomfort working from home than they did previously when they were at the office. And the same survey found that those same employees were working longer hours at home, and that was raising some concerns around their stress levels and burnout, with even 30% saying that mental health was presenting a barrier to their productivity. So, I think as work shifts virtually, organizations are going to need to consider how to not only keep their employees connected, but how to provide them with tools that are going to help them self-identify and manage risks within this remote working environment. So that's all on a remote working environment perspective. I think we also have to acknowledge that despite this shift to remote working, there's still far more jobs that exist and can only be performed at the workplace. And as I mentioned previously, I think the pandemic has really forced organizations to think about how they need to redesign their workplaces in a way that optimizes adaptability. So in a way that allows those operations to scale up and down depending on the available workforce without it resulting necessarily in long-term stoppages if employees are away sick. And that increased adaptability will potentially result in changes like greater process automation, right? More remote monitoring devices, or even how we'll need to organize work in a way that doesn't necessarily require human-to-human contact. Anything that we can do that provides adaptability in a sense that people don't have to get together in a normal way of operating certainly provides us with a degree of flexibility in the event that we have another pandemic or emergency where we have to keep people apart. So, a good question to ask ourselves is these are all interesting trends, but what impact are these trends having on health and safety planning and budgets? And last month, the analyst firm Verdantix, which is the principal analyst that surveys the health and safety software and technology market, they surveyed roughly 300 health and safety leaders across many global corporations, really on their thoughts on their EHS priorities and budgets for 2021. And in the report, they indicated that about 30% of firms plan to increase their health and safety budgets in 2021, which is incidentally 90% higher than the previous year, with 3 out of 4 prioritizing spend on safety and risk management, which itself is a good sign. But furthermore, 31% of those businesses indicated that they plan to increase their spending on EHS software, with a strong focus around how technology is going to help support their health and safety management. So, it does appear that more organizations are looking toward technology as a way to support managing these risks moving forward in 2021. And that's kind of a good lead into our last portion of the talk today. So as I had mentioned, with employers signaling growing interest in budgets for health and safety technology, I wanted to spend the balance of our time today really to review just a few key ways in which organizations might be able to leverage EHS software to address some of those key challenges and trends that we anticipate arriving in the new year. So to start, I wanted to start with a view on this idea of predictive insight. And for me, of all the lessons that we learned through COVID-19, I would argue that the value of insight is probably the most relevant. And really, what do I mean by this? Well, At the outset of the pandemic, many organizations struggle to detect where infection threats were emerging in their workplaces early enough to enable them to take prompt action before that exposure resulted in a wider outbreak. And we saw this, represented in the media in a number of cases. And what's interesting is this struggle wasn't because organizations necessarily lacked data. In many ways, it was because they lacked the capacity to transform that data into insights fast enough to enable them to identify where to focus. And this is important because when something negative happens, there's a natural tendency, I think, within organizations to assume that we lacked enough good data to make an informed decision to prevent whatever was happening from happening. So our default is to alter our processes to collect more data. And we see, however, that it's often not the lack of data that's the problem. I guess just a general comment, data growth has been expanding exponentially over the last 20 years, with some estimates, saying that by the end of this year, we will have collected about 40,000 exabytes of data. Now, that's a pretty massive number, and if you don't know what an exabyte is, let me put it another way. Right now, we are collecting enough data to fill a 3.5-inch floppy disk, for those that are old enough to remember what they are, a 3.5-inch floppy disk for every single person on the planet every single second. That's how much data we're collecting. So really the problem isn't data, in terms of how much we're getting. The real problem is that organizations lack the scalable capacity to translate that data into useful insights, principally because the way that they collect and analyze data is still done manually. And that's why we're seeing organizations, expressing a lot more interest recently around advanced data analytics, through enterprise software, which really enables them to use their data to create predictive models on what most likely will happen, and then in turn enabling those business leaders to make more timely decisions on priorities or or resource allocation, I should say, to manage risk and prevent loss. Advanced analytics is really offering that opportunity to shift from what I would call a diagnose and treat approach to more of a predict and prevent approach to risk management. So I'd argue that companies really should be asking themselves, are we getting full value out of the data that we're collecting? Or even to put it another way, is the value of the insights that we're currently gaining offsetting the cost of collecting and manipulating that data in the first place? And if that balance is skewed, it's probably a sign that your organization might be able to benefit from some of the advanced analytics that are available with enterprise software. The second key idea or key opportunity that we see through technology is this idea of risk self-management. So earlier, we had mentioned that with the shift toward remote work, it's creating a new risk profile for employees. So, for example, employees with poorly designed home workstations will likely be exposed to higher ergonomic risks. Just simply, they haven't set up their environment at home appropriately, and that's going to contribute to more pain and discomfort. And since employers don't have direct control or oversight over these remote working environments, it's going to require organizations to look look for more innovative ways to help their employees self-assess and self-manage those risks in those home environments. So what I've provided here is just a few examples of what organizations are thinking about right now. So on the left-hand side of the screen, I've provided a screenshot of one of Cority's products called OES as an example of a tool that workers could use to self-assess and manage risks in a remote environment. So with this solution, just as an example, this offers self-guided training to educate users on how to assess ergonomic risks in their home environment, and then provides simple recommendations that the worker can action themselves to address those risks and prevent the onset of discomfort. So I'd argue that organizations need to be considering right now how the changes that they're making to their working environments, both remotely and otherwise, consider how that might be impacting their workforce, and then consider how do you empower your employees with the tools and the training and the knowledge that they need to be able to take more ownership over that risk assessment and management process, because we understand that there's going to be constraints around either physical constraints between an office environment and a home environment, or within the regular work environment itself. Secondly, businesses need to or should be exploring how to plan to ensure that their employees receive adequate and timely training and education, whether again they're working from home or in a regular workplace. The need to maintain physical distance means that many of what we would call traditional in-person forms of training that are tend to be our go-to within the health and safety field aren't an option anymore, and certainly not for a number of months going forward. Gone are the days of simply pulling people into a meeting room. It's just not possible now. So as a result, organizations are looking for ways to flexibly develop and deliver learning content despite those constraints. And it's why we anticipate the explosion that we see in digital learning options, whether that be through learning management systems or micro-learning apps or things of that sort, will only continue to grow in 2021 and moving forward. And in fact, it's highly likely that the adoption of these different learning modes will continue to grow after the pandemic, specifically because younger workers have shown a clear preference to this kind of self-directed DIY style of learning. So again, organizations, my recommendation here would be, organizations should be exploring how to sustain their learning and training program through digitization, both in terms of how they plan and assign training, but also, how are they offering digital tools to create flexibility in terms of how they create and consume content that enables anyone to be able to access and go through training wherever and whenever they are. As a third point, when we talk about optimizing engagement, I think when we look back on COVID-19, I think one of the critical lessons that we will have learned is the power of engagement. For all the stories that we've heard in the media about organizations that have failed to protect their employees, I'd argue that there's probably more examples of businesses that have successfully managed risk by actively engaging their workforce and involving them in critical safety decisions. And I think, beyond COVID-19, I think we need to acknowledge that workplaces were changing even before the pandemic. Generally, we're seeing less supervisory oversight. We're seeing more self-directed work. We're seeing more teams working across larger operating footprints that are creating real challenges for teams to communicate. And as a result, I think we'll likely see more organizations shifting toward adopting mobile technologies as a way to better connect their teams and enable that real-time data sharing. So, from frontline employee perspective, that would be, how do we provide frontline employees with the data they need to plan and execute work safely, or to collect and respond to their concerns in real time without distance or restrictions, COVID-19 restrictions presenting a barrier. Supervisors need to be able to review risk assessments, authorize permits, assign work. And again, they need the flexibility to do that when necessarily they don't have all their employees in one spot. And certainly senior leaders, we're going to be challenged over the next few months and years around the ways in which we bring people together to share information, and moving toward mobile platforms provides just a little bit more adaptability and flexibility on what we can do to provide a little bit more opportunity there. Quickly, we had indicated a few minutes ago that we anticipate a significant shift in regulatory enforcement in the new year with the incoming administration. And I think that's going to shift a lot of attention toward how technology can support compliance management. Generally, when we talk to clients at Cority around compliance and how software can help them, they tend to present us with the same 5 kind of issues that we think can be resolved pretty clearly with technology. So the first is, they don't know what applies. So quite simply, it's difficult to know what rules to follow if you're unsure what those rules are. So really, we see opportunities for software to certainly alleviate some of the burden that's associated with finding out and keeping up to speed on some of the requirements that your organization is mandated to follow. And certainly when we integrate software with some of third-party regulatory content providers, they help research some of those standards and make sure that you're up to speed. So obviously that task doesn't fall within people within your organization. A lot of organizations, they struggle to operationalize complex requirements. So, it's organizations have to both understand what what they need to do, but also, figure out, how do I actually get this done? How do I operationalize these very complex requirements in ways that keep me in compliance to the law? And software is an opportunity that gives you a lot of features to deconstruct these requirements into very tangible compliance actions, and then assign those actions out to individuals that where you can monitor the progress and ensure that those actions aren't just simply lost in the whirlwind. As we mentioned before, people need data. They need to be able to access the data that they need when they need it, to be able to manage risk in real time, and really to create safety dynamically. And where a lot of organizations fall short is they have a great program on paper, and it remains in a binder somewhere and never really gets out onto the plant floor. So, moving toward a digital solution, especially with mobile applications that enable workers to be able to access and kind of dive in, pull out the information that they need out of their program and use it in the field dynamically is certainly going to be advantageous to a lot of organizations. A lot of organizations struggle with silos, right? So, in a lot of cases where employers run into compliance issues, it's because I often say the right hand doesn't know what the left hand is doing. So, one department initiates a change that introduces a new risk or a new requirement that's unknown until the inspector shows up at the door, and we're trying to explain the gap. And certainly with a lot of software solutions where we have the ability to integrate alerts and notifications into workflows, that ensures that those surprise developments and those changes don't come as a surprise, that they're well known in advance, and then we can work around that and make sure that safety considerations are realized before obviously a regulatory official could come to our organization. And then finally, the ability to measure results. I think quite clearly, without access to reliable data, it's really difficult to know whether the things that you're doing are having the desired effect. So again, we're seeing a lot of interest and we see a lot of opportunity for organizations in leveraging a lot of the massive resources that have been put in recently with business intelligence and analytics, and really enable you to get a clear perspective on, how are we doing? Are we focused on the right things, or where does our business need to shift? And then finally, we had talked a little bit earlier today about this connection between, the growing importance of sustainability and, how we see safety is becoming a more integral lever within sustainability initiatives. So that's not going to change. And for a lot of organizations, sustainability becomes particularly challenging because the reporting process is pretty arduous. It's a number of people across the business collecting a number, collecting, collating, aggregating a number of different metrics, and then being able to produce, the applicable reports and things like that. And again, with technology, we see a lot of opportunity to really streamline that data collection, reduce the time and effort to generate those reports. But at the same time, it's also to provide those very, clear, intuitive, visual business intelligence tools to be able to kind of track your performance in real time, and not wait a month or a quarter later to figure out you're not where you need to be going. Is that you can look at this data and you can manage issues moment to moment, and really ensure that you're allocating resources and people effectively. So that brings us to the end of the presentation. So before I hand the reins over to Barry again and open it up for Q&A, I just wanted to briefly recap what we talked about today. So, we started our talk by taking a look back at 2020, and we acknowledged that there were a number of significant events that occurred. And while certainly I would say that everything pales in comparison to COVID-19, we should be mindful of some of the developments that have occurred in with respect to deregulation and marijuana legalization and things of that nature, since many of our organizations are still going to likely face the effects of those decisions into the new year, and perhaps even further. Looking ahead, we talked a little bit about what we might expect from the new administration, and if I had to sum that up, I would probably say, be prepared for a much different, much more aggressive enforcement approach than potentially what you were accustomed to over the last 4 years. And I think, again, as we kind of ended off the last portion, there's some pretty interesting and significant trends that we're seeing in sustainability and changing workforce that I think will demand some pretty innovative solutions. And then finally, on a technology perspective, I just provided you with a very little, very small snapshot of what's currently floating around in the heads of a lot of health and safety thought leaders right now. But certainly, we see a number of ways that technology can assist, whether that be through analytics, mobility, compliance, or sustainability. And I'd certainly encourage anyone on the call that if any of these things are of interest to you, or certainly would have an impact to your business, do a little bit more research, and certainly consider how digitizing and shifting and digitally transforming your management system might be the next step forward. So with that, I will switch back over to Barry and open it up for any questions that anybody might have.
Great. Well, thank you very much, Sean. We appreciate you sharing your expertise with us today. And just a reminder for our audience members that if you'd like to ask a question, go ahead and click on that Q&A button at the bottom of your screen, type in your question, and press the send button. Before we start the Q&A, I wanted to let everyone know about an evaluation survey that we'll be asking you to complete. The survey will open in a different screen after this webinar, and your input is really important to us because we do use that input to help us improve our future webcasts. So Sean, let's go ahead and get to a few questions here. We had a few that have come in. Kathy in our audience mentions that you talked about employees experiencing a little more pain who are working from home. And she says, it's probably not just the hours, but also the stress and ergonomics not being the same at home. And Kathy wonders, Sean, do you have any insight into how much companies may be willing to invest in helping employees who are working at home with these type of issues?
Yeah, great question. Thanks, Kathy. Yeah, I think, there's going to be, I would hazard a guess, and we talk about this quite a bit, I certainly do with my colleagues, that the remote working, the home working environment is going to be almost an industry on itself, I think, in 2021 moving forward, because there was actually, over lunch this afternoon, I saw a report recently from another health and safety publication that said that 50% of employees were looking or would be interested to work from home permanently after the pandemic. So I think we're going to have to look, and this is why I always look back and say we can't look at this as a singular risk issue. I think you have to kind of look at it from the perspective of how does a shift toward a remote environment change the nature of the hazards that workers are facing. And I think certainly ergonomics is one of them, and certainly mental health is another one. Whether that be work hours and that connection, or how does the organization set up clear policies and clear barriers that would separate time at work versus time at home, because those lines get pretty blurred if you don't pay attention to them. And then again, some of the other resources. So again, this is where I would look back and say this is where I think technology offers a lot of opportunities, because imagine you're going to have to be able to really focus on how do I train this individual to be able to recognize these issues themselves, and to be able to come up with very innovative and cost-effective solutions to address some of those issues without the employer having to dispatch resources to everybody's home environment where they don't necessarily have control, right? It's this kind of weird gray area about what really is the controllable workplace for the employer. So again, I always come back to how do we optimize training to really build up the competencies that people need when they work from home to be able to identify and manage risk? And then are there different solutions that we can provide to them that make it easier? So as an example, and just to tie this off, we have a product in Cority that a lot of our internal staff use as well, and it's a break timer, where it's called RSI Guard, but it has a number of different features, and one of them being a break timer. And I often find that I can get lost at my laptop for hours and then not realize I haven't changed posture, and then that creates a pain. So certainly having a device that would pop up on your screen and tell you to take a break or get up and move, those are the kind of solutions that I foresee are going to be much more, organizations are going to look a little bit more closely at going forward, because they understand the constraint that they're not there and they just can't physically move things around. They're going to have to really rely on the better judgment of their employees working from home.
Great, thank you, Sean. And Carrie from our audience wants to know if you could clarify what you mean by mandatory infection reporting, and does HIPAA impact that or play into that at all?
Yeah, thanks, Carrie. Great question. So mandatory infection reporting, what I mean by that is obviously there's been a lot of back and forth with federal OSHA throughout the year on what type of infections, does an infection in and of itself need to be reported to OSHA or not? And just as an example, I think initially there was, and excuse me, they've gone through so many iterations. There was certainly, if you were infected and that infection was, all reasonable, a duly diligent employer were to do an investigation and find that there was a reasonable suspicion that this would have occurred at work, that would be OSHA reportable, whereas others that can't be attributed to work would not be, unless somebody would then, potentially succumb to that, and die because of that infection. So there's a lot of ambiguity and there's a lot of confusion. And then when you look at some of the states that have issued COVID-19 regulations and temporary standards, like Virginia, they have some very stringent requirements about reporting, what has to be reported by whom and when. Does it mean that it's HIPAA compliant? I would imagine that there would be some guardrails around the communication of health information, but certainly I think what these agencies are looking for is, are we seeing trends? Are we seeing trends of an employer not taking reasonable steps to quell infection? And then would an agency, whether at the federal or state level, dispatch an inspector to go look and say, are they really doing everything that they need to do, or are these infection rates, are they indicative of something wrong with just the way that they've structured their program? So that's what I mean by mandatory infection reporting. We'll still wait to see. I think generally there is going to be a little bit of flexing going on between all these different state level ETSs that have been issued and whatever will come out federally. So it'll be interesting to see how those reporting requirements, at least at a federal level, are going to hash themselves out.
Great, thank you, Sean. And we have Eduardo checking in today all the way from Argentina. And Eduardo's asking about, he's curious if you have some best practices for work at home folks. And he says specifically in relation to the preparation of the worker, the environment, and the relationship with the rest of the folks in the organization. What are your thoughts on that?
Yeah, great question. Thanks for coming, Eduardo. So I think, like anything, it's very easy to say, out of sight, out of mind, that if you don't see the worker there, it's with everything else going on, it's very reasonable to kind of lose sight of it. But I think the moment that you've given permission for people to work at home, I think from a health and safety perspective, what I would do is perhaps provide some templates or some guidance that a worker could go through to validate that they've set up their workstation, or at least that they've identified and they've been thinking about how to control some of the risk factors that are associated with that. So some of that might be a simple checklist where, that might have some ergonomic design guidelines that are associated with it. So very much look at the picture, look at your workstation. Are they comparable or not? And then through a process of elimination is really kind of drilled down to some of those key issues that are remaining. And if that individual still has some struggle, that there's some sort of mechanism that they can elevate that back to their employer and seek assistance. From a mental health perspective and a work-life balance perspective, I think really, any individuals that are permitting their subordinates to work from home, I would say, really try to think about, how do we create an environment where we're checking in on each other? So it might require much more frequent check-ins than you might think, but we often lose sight of those incidental touch points that we have in a regular environment, where kind of walking to the coffee maker or what have you, you pass by people, you check in on them. Those are kind of eliminated. Those social interactions are kind of eliminated in the virtual environment, so we have to recreate those virtually. So I think start by providing some tools that would enable individuals to really look at how do we identify potential risks of that are associated with this transition, and then really work to provide mechanisms that individuals can bring things forward and seek support on some of those home challenges that they may be facing.
Great, thanks, Sean. We have time for one more quick question today. And one of our audience members is curious, how should we, a health and safety practitioner, go about building a business case to convince management to invest in software? You talked a lot about budgets earlier. Can you share some of your thoughts on that?
Yeah, I'll say very quickly, I usually say three things. So I would start off with do your research on those critical issues that are compromising the efficiency and the effectiveness of your program, right? So really dive down, um, get involved, talk to your knowledge, your subject matter experts, your knowledge leaders, your super users, and really try to understand what's holding them back, and what's holding back progress in terms of health and safety. Focus your attention there. Don't try to fix anything that's not broken. And the reason I say that is we tend to see a very like a utopia that could be restored through technology, and invariably what happens is we create a scope that's far too big, and we can't secure budget for that. So really, drill down on the most important issues that you need to solve. Second thing is really look at your stakeholders. So that starts with having an executive sponsor, so somebody high in the senior leadership that can then certainly go to bat for you, that will be that sponsor, will be that advocate that can push decisions through the executive group. Look at engaging your end users, the people that are going to be most affected by the solution. Engage your IT department, engage consultants potentially. That will all enable you to kind of get a better perspective on how to organize the project in a way that it's going to be successful. And I would say finally, rubber hits the road. You have to show a cost benefit, right? You have to show that for the dollars that we're investing, we're going to get something out of this. So from that perspective, I would look at incident rates that could be avoided, legal expenses, whether that be through citations or fighting those citations in court. I would look at compensation costs. I would look at even the opportunity to in-house, like to bring back in a lot of services that you might have outsourced because you don't have the resources to do so. With the digital transformation, maybe it makes those processes available now to be done internally. So look at all those numbers, put them together, try to come up with a very clear, objective, quantifiable metric on what the project will save for the organization and the value it's going to bring. And I think if you hit on those three items, you're setting yourself up for success for sure.
Great. Well, thank you, Sean. I'm sorry, folks, we have run out of time, but for any questions that we didn't get to, those will all be forwarded along to Sean. Again, we hope you take a little bit of time to share your feedback through our survey. And I'd like to thank our outstanding presenter, Sean Baldry, our sponsor, Cority, and of course, all of you who joined us today. This ends today's Safety and Health Magazine webcast. Take care, everyone, and have a safe day.